Hello, Professor Jean-Marc Burgunder, and welcome to the 8th European Congress of Neurorehabilitation. The ECNR brings together scientific and clinical communities. What do you believe is the unique role it plays in bridging the gap between research and daily patient care in neurorehabilitation?
Well, daily clinical care in neurology in general, and this is true for neurorehabilitation as well, is very important to bridge knowledge from basic science, translational science, and to go also in clinic. So there is a very important interaction with both. On one hand, you need to have the clinical questions which are being asked, and then when you have those clinical questions, you can frame them and do some translational research. And the other way is also very important, that people in translational research would actually explain the results to the clinicians, and then together they can see whether they can apply this to clinical research and even more to clinical care in rehabilitation.
Considering your specialty, what future developments do you envision for the complex multidisciplinary field of neurorehabilitation?
That's a very interesting question. So there is a lot now going on in neuroscience in terms of deep learning and new methods in understanding the large set of data. And I think neurology is a field where you can get the most of this complexity of data. There are clinical data, there are imaging data with several modalities, and of course also molecular data, genetic data. And to pull this together with this new method is something very, very interesting. Now, other development, of course, are also technical one, to have better tools in order to help for rehabilitation. And also in the context of decrease or difficulties in finding personnel or staff to actually perform rehabilitation, or at some places where there is no staff. So the use of digital methods, including also use of the internet, will be very fruitful, and I hope some venues in neurology will be particularly open for that purpose.
Is there a specific trend or technology that you are most interested about?
Well, there are so many that it's difficult to actually tell, but I'm thinking about rehabilitation of speech. So here it would be a way where you could actually assess speech in people with neurological disorders in general, and then have a system which would respond directly, like an agent, which would respond directly and provide some clues to the patient in order to do a specific exercise for breathing and for speaking, and so this would be just one example, but there might be several ones.
And in your perspective, what is the most challenging future development in neurorehabilitation, and how can the FNR come closer to this endeavor to help?
Well, the FNR is very important as a society, and as we said before, the bridging of basic translational science and clinical science is very important, and I think is highly important that this field of neurorehabilitation is being examined and taken over or covered intensively by a specific organization. However, then it's very important that these ideas and the views, the concepts, and also the future perspectives are being brought back to the larger community. And here I'm thinking about the World Neurological Federation, but specifically in Europe, the European Academy of Neurology. It's very important that this knowledge is being brought back to this, because neurorehabilitation is not only something for people in the neurorehabilitation, but also neurologists in general should have an understanding of the importance of neurorehabilitation, and also guide their patients, guide their teams in order to apply appropriate methods in neurorehabilitation.
Based on your experience, how can we improve the rehabilitation of patients with Huntington's disease, and what are the most common mistakes to be avoided?
That's very interesting question. Indeed, what I said before in a general way is valid also for Huntington's disease. Now, in Huntington's disease, there is a huge complexity of the phenomenology. Over the course of the disease, it can change, starting with children with Huntington's disease and going up to people in older age, like 70, who the disease would actually start. And this is the same gene which is changed, but the presentation is completely different. So there is an important way of targeting, personalizing the rehabilitation, the different parts of rehabilitation. Then the second problem is the lack of people who have actually experience in Huntington's disease. So people who have experiences Parkinson's disease or stroke may not capture at all the issues and the problems people with Huntington's disease have. And this leads to my third remark. It is highly important in Huntington's disease to have a very strong empathy. It's very important to know the disease. Like, for example, if it occurs quite frequently, patient says, oh, I have Huntington's disease, and the doctor or the physiotherapist or the speech therapist will do what is Huntington's disease? So the patient or the family needs to tell these people about Huntington's disease. And very frequently, there is a reaction of the care provider, like, shocked, what is Huntington's disease? This is a terrible disease. And if the patient feels this shock, they will be completely blocked and nothing can happen. So knowledge about the disease, increase in empathy for people who can take care of patients with Huntington's disease and their family is, from my perspective, a very big challenge.
Thank you very much, and thank you for being here at the Congress.
Thank you for the invitation, of course.